Thank you very much, Martha, for those introductions. And I just want to say good afternoon to Chris, and thank you for really coming to listen to us. As Martha has introduced my topic, I'm going to present a case study of Indigenous knowledge ignored. Martha, next slide. AmaBomvane is an indigenous community from the. Can everybody hear me?
I can hear you. Gubela.
AmaBomvane are an indigenous community from the Eastern Cape province of South Africa. Okay. They live in an area with around the Indian Ocean, Mbashe, and the Kofa rivers. A majority do not have formal education, and knowledge is usually carried and shared by word of mouth, and before education happen at home and in the village space. Next slide, Chanel.
Sorry, it's just a bit delayed. There we
go. This area, which is usually loosely called Bomvane land, has green vegetation with small forests and scattered one big provincial nature reserve. There is a strong symbiotic relationship between people, animals, and water and land. A majority of births still happen at home with placentas combined with the soil. Animal and human residue create fertile land, and it is believed that by people who live in this area that when somebody is sick, they will always be available help to deal with this sickness. Next. Before democracy in 1994, in this area, there was no running water, no sanitation. And the access to water from the was gained from the Mbashe and the Koka rivers. In the area, households distance themselves from each other as an indigenous strategy to accommodate absence of water and sanitation. Next slide, please. Here in Bomvane land, there is a belief that each household should have certain obligations. And there are certain principal obligations which they are geared towards a healthy home. And there is a belief that each household contributes to the village, healthy young adults and children. There's further a strong belief that healthy, happy homes makes happy, healthy villages. Hence, it is an obligation of the home to do the following. Next slide, please. That each home should support children from conception through the various stages of development until adulthood. Next slide, please. That each family should produce sufficient food to feed family until satiety. Next slide, please. That overall, when all these obligations have been met, the community, the village, must give spiritual reverence to ancestors to celebrate achievements of obligations. Next slide, please. When we entered this area and we met with the indigenous, believe health indicators are very low. He also believed that outside influences on religion, education, and health contributed to low health indicators. He also asserted that these are three pillars of society that are contextual and cultural bound. He said that prior to foreign entries in the area, Bomvane were religious, they were educated, and they were healthy. And he has the perception that disturbance of these three pillars of society create social inequities and negative social determinants of health. And for him, often at the end tail of ignored negative social determinants of health is impairment and disability. Next slide, please. Now, I want to expand on how allopathic healthcare was initiated in the area. Initially, the allopathic healthcare was brought by missionaries in the 1950s and later taken over by the government of South Africa. Missionaries were mainly white people from the Dutch Reformed Church. One person would assist with being a doctor, an educator, and a minister of religion. Hospital was far away from households, and consultations were done quite late when conditions had complicated. The managers of the hospital had to advise the community of this area to bring their households closer to the hospital. Unfortunately, no consideration was given to water and sanitation, nor indigenous methods of having households far apart to accommodate absence of water and sanitation. Now I want to speak a bit about the relationship of the indigenous community with allopathic healthcare providers. And I want to say in this presentation, this was actually a silent, symbolic violence. Allopathic medicine in this area focuses on curative care. Generally, there is a paradigmatic difference. Indigenous community believes strongly in understanding the background of illness, and to them, illness is about broken relationships, and for one to become better, one who needs to heal relationships. How healthcare is delivered by the hospital is a huge frustration for the indigenous community. Indigenous community appreciate being helped with stabbed chest and car accidents, but for the indigenous community, this is not enough without understanding why a person was stabbed or had a car accident to prevent this from occurring. In the quiet, the indigenous community still holds strongly to their indigenous health belief, and this is a thorny area for the allopathic medicine. As they believe patients are brought to the hospital quite late, presenting with complications. Allopathic medicine holds high moral ground and end up chastising the sick persons from indigenous community after using indigenous medicine. While at night, nurses from the area creep to the indigenous healer for indigenous health care. The chastising of patients results in a veil of secrecy and a violent silence, with two health systems running parallel to each other. I also want to share how then, when the household were brought closer to the hospital, how household accessed water. There were minimal choices for streams and tributaries from Kocha and Mbasha River. People, animals, and pigs use same area for drinking and defecation. There was general disempowerment, waiting for government to come and sort out situation. One of challenges facing community is infestation with Taenia Solium pork tapeworm. Hospital being close to this river, which had piped water and sanitation, but continue to treat patients that are struggling from consequences of absence of water and sanitation. Next slide, please. I want to share a little bit about Taenia Solium pork tapeworm. Taenia Solium porkworm, humans develop an intestinal infection with adult worms after injection of contaminated pork, or may develop cysticercosis after ingestion of Taenia Solium eggs. Human beings become immediate hosts. Due to water and sanitation problems, a vicious cycle emerges with infestation from humans to animals and vice versa. Next slide, please. Now I want to speak a little bit about the impact of Taenia Solium and response of healthcare in Madalweni. Some of the features of being infected with Taenia Solium tapeworm is seizures, hydrocephalus, altered mental status, aseptic meningitis, or in one person, you can have a combination of all. Medical staff are doctors mainly from European countries, nurse usually from the community and is the pillar of the health system. Patients with both mental health problems and disability are brought late with complications. The nurse who acts as interpreter has minimal understanding of mental health problems and disability. When unsure on how to handle mental health problems, nurses turn around and advise patients to consult Indigenous healer. Patients believe medication given hardly helps seizures and mental health problems and opt to visit Indigenous health practitioners. So now, how does one respond to such a situation of AmaBomvane and the ignored social health determinants of health? We are suggesting that maybe the first point of entry is to prioritize social health determinants. Secondly, to address water and sanitation issues. To try and raise awareness on consequences of eating infected meat. To conduct basic education workshops on mental health and disability. To try and implement a strategy to improve relationships between allopathic health practitioners and Indigenous community and its healers. To also use positive inquiry, identifying assets and low-lying fruits to assist the community to start imagining the future of their children. So then, what are the implications for global health in Africa? AmaBovane case study can be transferred to other rural communities in Africa. The primary concern for one is to address health and well-being of community. That should be the focus. Social determinants of health need to precede and be at the core of whatever we are addressing. The key question is how biomedical healthcare systems can co-create together with Indigenous communities models of best practice in Africa for health and well-being of communities. Madalweni Indigenous scholars suggest a backward and a forward movement, whereby you take what is good in Indigenous knowledge system and combine with what is good in modern healthcare system. And with this combination, bring a robust, colorful blanket made of integration of the two health systems. And we also believe that global health departments in Africa could play a facilitatory role in knitting this colorful blanket. With that, I thank you.